welcome. I'm Dr. David Warwick of Warwick Chiropractic in Lacey, Olympia, Washington. Today I want to share probably one of the more important blog articles, but before I do that, I want to give due credit to chirotrust.org, where this particular content is coming from, as well as the references that you'll find on the blog. It's chirotrust.org, and you'll find the actual title when you go into there, Managing Pain and with the chiropractic adjustment. I think this is important for people to hear and understand a little bit. In fact, it's starting to gain some traction on some of the social media platforms, and discussing how big of a problem pain is in America. And 238 million adults in America, and 116 of those are suffering with chronic type pain, musculoskeletal, mainly that of being of the lower back, as well as the knee and the neck. There's other percentages on that. And I'm going to be referencing from this article and how that can affect what we as healthcare providers see every day. And the big thing to understand is that chronic spinal pain has been a challenge for most of us in working with, and a lot of it is discovering what ways we can change that for pain sufferers, especially the chronic. And one of the references is Dr. Candace Pert, who is discoverer of the opiate receptor. And what I can say is that it's essentially the site for the endorphins of the brain. The opiate receptors can change that chronic type of approach. And so I just want to give you a little anatomy orientation without making it too difficult, and that's the opiate receptors are actually in a portion of the brain, upper brain stem, in the cerebral aqueduct area. That's the gray matter, and we call it the actual gray matter in there. So it's part of the mesencephalon, a portion of the brain, and this is where we feel a lot of the pain and pain receptors in that area. One of the things that can change that over the years, and you'll see that when you're looking in there, is that electrodes, when they apply a stimulation to that area, reduces some of the pain for people, especially when they've been suffering chronically. I've had patients both where they've had the electrodes implanted and changing some of those areas, and some had improvement, others did not. So it's understanding that type of stimulation and how that can offer a bit more long-lasting pain relief, essentially, with people that are experiencing that kind of thing. See, there's different types of pathways that descend down all or into the ascending systems of the nervous system, and this is where we receive stimulation or stimuli, especially pain signal. Many times the electrodes create a anesthetic for that area, and so this essentially can be used and changed to help people with those pain pathways that are occurring there. When I look through the article here, one of the things that was noted, the electrical stimulation of the gray matter, they referred to the blood-brain barrier, which is often a barrier where certain toxins and pathogens can enter and create certain kind of diseases. The portion of that is understanding that the stimulation of these receptors have taken on a different effect and by some of the things that we do today. And one of that is prescribing pain. And so the pain medications that are being used today, pharmacy products that are being overused, overutilized, overused, overprescribed. And these receptors are creating a rapid receptor adaptation. So what we know is that it's creating serious types of addictions, threatening addictions, euphorias leading to other drug addictions when they can't get that type of pain receptor or pain medication. So you're essentially, when you take a medication, here's essentially what happens, is that you're blocking pain signals or trying to change pain signals, and that may be good for short term, but some of that prescription, may be overutilized, and it creates a cycle or an addiction that starts to happen. And this is one of the things that America is dealing with. One of the countries that we're dealing with is overprescribed medications. And while it may have a short-term effect, but for the long-term pain, we have almost 9.4 million Americans taking types of opioids. And when they can't get that kind of medication legitimately, because it is somewhat controlled as well, by your physician, but you have patients that'll hop from physicians, and what happens is that they start looking for other types of drugs, such as heroin. All these type of things, start leading to more addictions, problems within the family, problems within society. So, the drug use and abuse is just compounding. But what we're finding is when you understand the anatomy of the spine, there are 24 movable segments in the spinal column, and each of these nerves have a particular function or component to it, and a particular function that affects the whole spine and our whole body as a whole. And so these type of disorders, have an examination of each of these different components of the cervical, thoracic, and mainly lumbar spines. And there's many studies that you'll see in there, and the effects of spinal manipulation and the physiotherapy type treatment to change some of the pain dysfunctions that people are experiencing. So this is way beyond a simple placebo or control effect, and you'll see that in there when you look inside the blog article that I'm referencing. There's so much information that I wanted to share with you, so I'm trying to narrow this down. The role of so here's essentially when you have a high velocity, low amplitude type thrust, that is essentially an adjustment or one type of adjustment. There's many mechanisms, but the manipulation actually causes a pain relief. And hopefully this gives you a better understanding that the important aspect of restoring motion to a restriction and taking pressure off of the nerve is one, and a simple aspect of offering pain relief to that patient, and understanding that this improves physical performance and reduces the disability of the individual. So let me bring concluding remarks in some of this, and I'm essentially referencing from the article that the periaxial gray matter that descends is an inhibitory control center. It's your control center for understanding pain, and there are links to opioid receptors, especially the descending pain control system. And that while there may be substantial and serious risks of using implanted electrodes, not as beneficial. And obviously I discussed the opioid, the pharmacology or the pharmacy aspect of it, and the type, while these are choices you can do, what kind of epidemic that it's produced today in this modern world, and crisis that's creating addictions, also increased risk with heroin and other drug addictions, and including death. Consequences that we're starting to see trickled in affect crimes. All these things are becoming part of the big picture. Crimes, incarcerations, and what a big society type nightmare that we have with this. So when you use there is plenty of evidence showing that the spinal axial manipulation and adjusting of this pain control center, mainly in, speaking from the cervical spine in your neck, as well as the lumbar or low back, has a certain indication of reducing some of the chronic pain, and also creating improvement in what we call the spinal biomechanical or motion function of the spine. So, and this has a very minimal risk to it, and that's why you're seeing more and more patients seeking chiropractic care, or incorporating multiple modalities of treatment for the chronic pain, the chronic mid-back, low back, or neck pain, or even nerve pain, pinch pain. Look at the blog article. I'm going to again reference it. If it's from chirotrust.org. The title of the blog article is Managing Pain with Chiropractic Adjustment. So thank you for watching. I'm Dr. David Warwick of Warwick Chiropractic in Lacey, Olympia, Washington. I actually found this probably one of the better blogs that I've seen over the year, and I hope you understand that you have choices, and maybe to work with some things that are more natural and seeking out a chiropractor that can help you. So thank you for watching. I'll see you soon. Look at my YouTube channel, visit my website at drdavidwarwick.com. You'll get a ton of great information on there. Subscribe. I'll see you soon. Thank you for watching.